Public input. Workshop participants were presented with the opportunity to weigh in on ideas, share experiences, and provide suggestions for future focus in moving the workshop initiatives ahead. Items and needs discussed include the following: standards for evacuation planning and preparation. The need exists for creating a standardized approach to addressing gaps related to this topic, such as individual buildings and facilities, homes and residences, community considerations, evacuation routes, and planned implementation, and approaching this matter from the perspective of special needs versus disabilities. Product standards on evacuation chairs or descent devices. Manufacturing specs could be evaluated against the need for a product standard on evacuation devices. Considerations include size, shape, capacity, usage for going up versus coming down, and post-evacuation procedures when a wheelchair is left in evacuated facilities. It was noted that RESNA could be looked at as a contributor in future workshop endeavors, as they have begun work in this area. Standards or revised standards on the integration of disability and special needs to current or new built environments. This need addresses consideration of public or work buildings, residential multifamily dwellings, and single-family homes, incorporating egress versus access needs. Standards or revised standards to integrate alerting. Such standards could cover the scope of dissemination and communication of information, as well as devices used for alerting. There is a need for consistent and complete messaging in addition to well-crafted and evidence-based messages. Additionally, there is a need to address methods to provide accurate and continued updates to allow for an effective decision-making process. Single location for demographic data. At a minimum, data should be centralized at the county level at a single source to ensure credible, accurate, and up-to-date data. Standards on functional medical shelters and operation of these facilities. Research to determine what has been done and by whom. This assessment should include information pertinent to topics such as stair flow, effectiveness, elevator changes, and building changes. More importantly, however, this literature search should include conclusions and/or recommendations, ideally kept in a centralized platform. Standard for 911 communication procedures. A review of communication methods should be conducted and should include research related to contacting 911 by means other than by telephone. The National Emergency Number Association, NENA, and the Federal Communications Commission were identified as potential outreach candidates for inclusion in future efforts. Additionally, the FCC hosted a summit on deployment and operational guidelines for next generation 911 and E911 systems on February 25, 2009. Potential for expanding the ANSI-HSSP Homeland Security Standards Database, HSSD, to include topically relevant categories. Bring together a task force of volunteers to develop a list of standards. Public education related to standards. Standards for integration of training and drills. Needs for federal policies. Questions remain as to what federal policies should be developed. This should be looked at more closely in order to progress the work of standards-based solutions related to the community of persons with disabilities. Guidance on writing policies. An opportunity exists for workshop participants to look into the possibility of developing templates to aid in writing policies related to this subject matter. Standards to address transportation needs and plan for evacuation processes. Consideration should be given to carless cities and urban versus rural areas, campuses, and various types of vehicles used for the purposes of evacuations. Standards for wireless emergency communication.